I'm Gemma Peters, Chief Executive of Bloodwise, the blood cancer charity. We wanted to update you about the work that we've been doing on coronavirus because we know that there are such high level of concerns among the blood cancer community. We've been working closely with experts and other leading cancer charities to produce a list of frequently asked questions and some advice which is both accurate and will be consistent across all the different cancer charities, which we hope that you will find useful. But also I just wanted to talk a little bit about some of the specific needs of people with blood cancer, because it is true that in blood cancer things are a little bit different because more people with blood cancer are likely to be immunosuppressed than in other types of cancers. So the first thing I want to do is just help you clarify if you are someone who might be at additional risk. And I want to read this bit because I just want to make sure I get it absolutely right. So the people who are immunosuppressed and therefore need to take extra precautions, which we'll talk about in a second, are those of you who are having chemotherapy or if you've received chemotherapy in the last 3 months. Those of you who are having immunotherapy or are continuing antibody treatments for cancer. Those of you who are having other cancer treatments which affect the immune system, like protein kinase inhibitors. Those of you perhaps with lymphoma who might have had intensive radiotherapy. Those of you who have had a bone marrow or stem cell transplant in the last 6 months, or those of you who are taking immunosuppressant drugs still. There are some types of blood cancer as well where the cancer itself reduces your immunity and damages the immune system. So even if you hadn't had treatment, for example, if you have a chronic leukemia, lymphoma or myeloma, then you're also at additional risk. So for those people where the consequence of getting coronavirus would be more serious than it would be for the rest of the population, our advice is of course that you follow what is being put out there at the moment for the general population, which is making sure that you are regularly washing your hands, using antibacterial hand gels where appropriate, avoiding physical contact with people, avoiding touching your face where you can. But in addition, because of the risk if you were to get coronavirus for those people in that group, our advice is that you take steps to distance yourself from places where there might be people who, unknowing to them, already have the virus. So that doesn't mean isolating yourself at home, but it does mean taking precautions about going to places where there will be other people. So for example, going for a walk around the park, totally fine, continue to do that. But think carefully about putting yourself in situations like crowded supermarkets or on public transport or events where there are lots of people and you have been in physical contact more than a meter, with less than a meter's distance between you and other people. That really thinking carefully about putting yourself in that position is sensible advice given the potential consequences were you to get coronavirus. The second area of concern that we've had lots of people contact us about is that lots of you are undergoing treatment, and so you have to go to a hospital, and clearly hospitals are places where potentially you're at the greatest risk of coming into contact with someone who has got coronavirus. We've spoken to our clinical advisory panel and other experts, and I know many people and many of your clinical teams are taking steps to try and do things by the phone where that's possible, to do video appointments where that is possible, and also to reschedule blood tests, routine blood tests, away from a hospital environment and to your local GP surgery where possible, where clearly the risks would be lower. So our advice, if your clinical team haven't been in contact with you already, is that you get in contact with them about any future appointments and see if any of them are suitable to be rescheduled to happen virtually. Clearly there's a balance of risks here. If you need to go to the hospital because of the treatment that you're having, then that's really important that you do that and follow the advice of the clinical team, and they will absolutely be taking all the precautions that they can to keep you safe. The next area of questioning we've had, or inquiry we've had a lot of, is from people who are caring for people who have blood cancer or in one of these groups, and what advice should they take? Our view, having consulted on this, is that you should if you're in regular contact with someone and you're caring for them and they've got blood cancer and are in the at-risk groups I've just identified, is that you should follow the same precautions as them, because clearly the most likely source or potential route to someone getting coronavirus could be through people they're in close proximity with. So we propose that you should also follow the same measures outlined above. Now, the environment on this is changing all of the time. The advice is changing and the situation is changing, and I know how worrying it is for everybody, and we see our top priority as making sure that you have the most accurate information from the very best and most reliable sources. So we are in touch regularly with the NHS, with our clinical groups. We've got a meeting on Wednesday later this week of the clinical advisory panel. It's a topic for discussion there. As any of the advice changes in any direction, we will be keeping all of our social media updated, our website updated. So please follow that for the most up-to-date information. Also, we are very mindful of the impact that the worry has, and potentially changing your daily life has, on people's mental health. So if you want to talk to someone and get advice specifically about that, or any of the other things we've talked about, then remember that you can always call our helpline. The number for that is 0808 20 80 888. Please call them at any time. There's also an email address if you'd rather put it in writing, which is support@bloodwise.org.uk. My final thought is that you will see on the document we've published, we try to group the main questions that people were asking us. If there are questions that you have that you feel that haven't been answered in that document, then let us know on the email address that I've just outlined, and we will include it in the next iteration of the document that we will publish along with other cancer charities. So I hope that this is helpful, and that if you have any other questions, then get in touch and we will do our very best to help. Thank you.